understand why. You need to know why you are doing what you are doing. What is the purpose of face shield as compared to safety glasses? If you're wearing safety glasses, do you ensure that you wash your face before leaving work each day? Do you understand the modes of transmission and how an aerosol procedure is different than sitting in an operatory recording information during an exam? Now, more than ever, we all need to look at our habits and find ways that we can work as a team to supportively educate ourselves in the concepts of infection, prevention, and control. Understanding infection prevention and control, or what we call as PPE, is not the first defense. Working in dentistry has always prevented risk due to the possibility of disease transmission. To best protect your patients, coworkers, and yourself, you need to understand how diseases are transmitted and how to prevent transmission. Chain of infection. Understanding of the chain of infection is important. This is a chain that is meant to be broken to stop the disease from spreading. Disease transmission is more likely to occur when a practitioner does not have a clear understanding of how to break the chain of infection. You will note that while personal protective equipment, the PPE, is one of the tools to break the chain, there are other precautions that must be considered as line of defense. Chain of infection. Number 1, pathogen. Infectious agent capable of carrying disease. This include bacteria, fungi, viruses, prions. Break the chain through number 1, understanding infection prevention policies and procedures. 2, sanitizing or cleaning. 3, disinfecting. 4, sterilizing. Number 2, reservoir. In people, equipment, water. Break the chain through number 1, patient screening. Number 2, reducing the number of staff patients in contact with each other. 3, hand washing. 4, housekeeping. 5, flushing lines. Number 3, portals of exit. This include blood, saliva, skin, excretion, aerosols. To break the chain, we need to, number 1, reductions of aerosols. Use a high volume evacuation and dental dam isolation. 2, patient staff isolation. 3, respiratory etiquette. 4, hand washing. 5, PPE. Number 4, mode of transmission. Can be direct or indirect physical contact, droplets, airborne. To break the chain, we need to, number 1, proper PPE fit. Number 2, properly donning and doffing PPE. 3. Hand washing. 4. Cleaning, disinfection, and sterilization. 5. Redesign or rearrange workplace settings. Number 5. Portal of entry. Mucous membrane, respiratory system, digestive system, broken skin. To break the chain, number 1, hand washing. 2, PPE. 3, covering wounds. 4, physical distancing. Number 6, susceptible host. Immune deficient, diabetes, age, surgery, ADA and C or corona COVID-19 risk levels. Break the chain through number 1, screening patients, staff for level of risk. 2, stress reduction. 3, diet and exercise. 4, immunizations when possible. And 5, intact skin.
Within the first question, what are basic PPE requirements for treating patients? And is anything different if the patient is confirmed COVID positive? I think Eve covered that very directly because if you have someone who is suspect or confirmed, you have to be practicing droplet and airborne precautions. And if you're only moving to urgent care using teledentistry, standard precautions still is the same and includes a number of factors such as wearing the gown, FDA cleared surgical mask, protective eyewear, or a surgical mask and face shield. But there are updated PPE recommendations for the care of patients with known or suspected COVID-19. We encourage all of you to move to urgent care only and practice that teledentistry. Eve, did you want to add anything?
Sure. I was in the issue of surgical masks. I think some people also have been asking questions about the different levels of masks out there. So surgical masks are level 1, 2, and 3, and the levels indicate the mask's ability to filter, its fluid resistance, and its flammability. And those are manufacturing standards. The CDC does not make a specific recommendation on level 1, 2, or 3. They recommend surgical masks. But understanding what those are and then making decisions about the amount of fluids and so forth that you're going to encounter would inform your decision on which level to use for which dental procedures.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. 95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. Not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Face shield or goggles. Perform hand hygiene. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove-in-glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.